Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Today's topic is, how does an employee group plan work with Medicare? We get lots of questions about this. Lots of folks working and ask, should I start Medicare while I'm still working? Well, folks, that just depends. And so what I'm going to do today is I'm going to address 5 different issues regarding this question. Number one would be this: how many insureds are in the group? This needs to be known because this is going to decide whether you're going to even consider Medicare or not as an option while still working. So how many people are covered in the group plan? Now, some of you are working for companies that have multiple thousands, so that's pretty simple. But others of you, you're going to have smaller group plans. So here's the way Medicare defines size of group. Number one, are there 20 or more in your group, meaning 20 or more people that are insured by that particular plan? Well, if that's the case, your group plan then is going to be the first one to pay any bills, and then if there's a balance of those bills, then it could go to Medicare for them to consider paying. Now, you've got to remember, in regards to this, what is it costing you to be covered by the group? Is your premium, $200 a month or $300 a month, or what's actually costing you, probably out of your paycheck, to be covered by the group plan? That's an issue. Because remember, if you enroll in Medicare, we have 2 parts to Medicare. A, and that is 0 premium, but B has a premium. And so I'm shooting this video in 2020. Right now, the premium for Part B is $144.60 a month. If you're taking Social Security, which most of you probably are not, that would come out of your Social Security check. And if you're not taking Social Security, they bill you for that on a quarterly basis. So it's going to be times 3. So basically $450 every quarter for your Part B. Now, if you're single and your adjusted gross income is $87,000 or less, that number is correct. If it's above $87,000, that's going to be more. If you're a married couple, you file jointly. Who's ever on Medicare, either one of you or just one of you, if it's $174,000 or less, that is correct. But if you're above $174,000, then that number is going to be higher. And so the whole point is this: as we look at this possibility of going on Medicare while we're still working, this is question number one: how big is the group? Now, over here, so if I have a premium that's costing me $200 to $300, then I also got to pay Medicare. And again, that may not be a very good financial move for you. And so you've got to consider that. Now, for those of you who are actually in small employer type plans, if you have 19 or less, then the order of payer is going to change. Medicare will pay first. So when you go to the doctor, you go to the hospital, and you're in a small group plan, then those bills are first going to go to Medicare. Medicare is going to pay their portion. And if you're still covered by that group plan, then they're going to be the secondary payer. And again, if I've enrolled in Medicare, in this instance here, I have A and B, so I'm paying for my Part B, $144.60, and depending upon what that group plan is going to look like as far as your premiums, then you're going to have to kind of calculate that into this particular decision. I would tell you this: normally, if someone is in a group plan that's less, what we typically would do is tell them to go ahead and just drop the group plan entirely, and then have Medicare first, and then you would get some kind of a supplemental plan to pay a second to Medicare. That's the normal situation when someone is in a group of 19 or less. Now, by the way, you don't have to do this, but the official rules of Medicare is this: if that group plan insurance company says that they want you to go on Medicare, they actually can make you do that. Now, many of them do not, but if they said, yes, we want you to go on Medicare, then in this situation, probably just drop the group plan entirely and go ahead and take Medicare with a supplemental plan. Now, if you're in a group of 20 or more, they cannot make you go on Medicare. Now, I know you'll have some people that are in the HR department, sometimes even co-workers that will say, oh, you've got to get a Medicare. And folks, if your group is 20 or more, you do not have to do anything with Medicare whatsoever, okay? So it is not true. But 19 or less, they could make you do that. All right, so that's what we're going to do in a small group plan. Let's look at the fourth issue in regards to this question. And you need to know, folks, that the Part B date of your Medicare is critical. And I'm going to teach you why, because everyone has what we call a Medigap open enrollment period. Medigap open enrollment period. This is also called a Medicare supplemental open enrollment period. And so here's the way it works. Let's say your birthday is January 1956. And that means that you're going to turn 65 in January 1, 2021. So if you decide to enroll into Medicare, your birth month, again, January of 2021, your A date would be 1/1/2021, and your B date's going to be 1/1/2021. And when we say the B date is critical, here's the reason: because this Medigap open enrollment period, which it's tied to you. This is not Medicare's open enrollment period or Medicare's annual enrollment period. This is tied to you, and that date is tied to your B date. And this open enrollment period for you lasts 6 months, and that's it. And what that means is during the 6 months of this Medigap open enrollment period of your B date, you have the right, once in a lifetime right, to have any Medigap policy that's sold in your state regardless of your health conditions, which means pre-existing conditions are of no concern here. Any kind of health issues, whether they be minor or major, are of no concern whatsoever, because 6 months of your B date, if you want to get a supplemental plan, then those companies that offer those plans in your state have to issue the policy regardless of your health. They have to give you that policy. So in my example, our B date is January 1, 2021. 6 months would be January, February, March, April, May, June. So during those 6 months, January to June, anything you want. But notice, after July 1, my open enrollment period is now over. And now from July 1 on, 2021, if I ever want to pick up a supplemental plan, now you're going to have to medically qualify to do that. And if your health is questionable, you have serious health issues going on, sometimes even a few minor health issues going on, you may never be able to pick up that supplemental plan again, because the 6 months they must take you, but after that they do not. And that's why we're saying that Medicare Part B date is critical. So as you make this decision, whether you're going to go Medicare while you're working or not, you still are going to exercise that Medigap open enrollment policy period if you decide to start your Medicare while you're still working. All right, so that brings us to the fifth and final issue, and that's this: what are your Medicare options while you're still an employee covered by a group plan? And by the way, this would also mean if you're covered by a spouse's employee plan, because it doesn't matter whether it's you're the employee or your spouse is the employee. Everything that I've just taught and will do on this one still applies. So what are Medicare options? Number one, you can choose to do nothing. All right? You don't have to do a thing. Now remember, as long as you're in a group of 20 or more insureds in the group, that employer cannot make you do anything. And if someone says you have to do something, they're absolutely wrong. Now remember, if you're in a group of 19 or less, and they tell you you must go on Medicare, then that doesn't apply to you. They have the right to do that. They have the right to say, no, we're going to pay second as the insured, and Medicare is going to pay first. So 19 or fewer in your group plan, they can do that. But otherwise, if you're in a large group, you don't have to do a thing. One option you have is you could enroll in A only. Now up here, we don't have to do A or B. But here you may make the choice to enroll in A only while you're working, which means what? When it comes to a large group, Medicare is going to still pay second in the hospital side of your coverage. That's what A is. Remember, A is hospital, B is medical or outpatient. So A is inpatient, B is outpatient. This means you're just enrolling in the A of Medicare, the inpatient side. So you can make a choice to do that. Now, what I want you to realize is this. One group of you that would not want to do this is anyone who is still working. And again, we're in a group of 20 or more, and you're contributing to a health savings account. All right? Health savings account. Now listen, I didn't say health reimbursement arrangement. I didn't say a flexible spending account, because what I'm teaching you right now does not apply to those. Only HSAs. And here's the rules. If you enroll in any form of Medicare, A or B or both, you can no longer make contributions to your HSA. And if you're going to keep working, that HSA is a tax advantage account that you get to have contribute money pre-tax so that you can have money for future medical expenses. And so it's it's like a healthcare IRA. And so you don't have to take A, but if you do take A, no new contributions to your HSA. You must stop those contributions. So that's one of the consequences of doing Medicare A only. Now, another option you have while you're still working is to enroll in A and B. A is going to be free. B, remember, is the $144.60, and as long as your income is not above the $174,000 as a couple or $87,000 as a single person, and then you could take A and B, and then you stay on the group plan. Now, remember the consequences of this. If the group is large, what's happening? A and B pay second, your group's going to pay first. And so sometimes that just does not make financial sense. The second consequence to doing this would be you just started your B open enrollment period for your Medigap policy. And so you only have 6 months. And so if you stay on that group plan more than 6 months, in this scenario here, what's going to happen? Once you get off of that, you're going to have to medically qualify to pick up a supplemental plan. All right? So I would tell you right now, that would not be a good choice in my opinion. Okay, it just would not be. If I didn't like my group plan and I'm still working and I have a large group, I would just drop the group plan entirely and go ahead and go on Medicare A and B and pick up the supplemental plan and just eliminate that. That would be the normal advice we'd give to you if you're in a large group, if you don't like your large group plan. All right? And remember, if you drop the group, who else is going to be affected by that decision? Could be a younger spouse or children. We want to make sure they're not going to be adversely affected by that move. And then lastly, you can enroll in A and B and then drop the group, and that's what I was just telling you. That is an option. And for some of you, especially if you're not happy with the coverage at work, the cost of that, maybe the deductibles high, or maybe the co-payments and those things, you're just very unhappy, then go ahead and drop the group and just take A and B only, and then you're going to add a supplemental plan to that, and then you'll add a prescription drug plan to that. Okay? And for some of you, that's going to make a lot of sense. Now, I would tell you this, before you drop that group plan, again, we want to make sure no one else is hurt by that. But secondly, and then I'll close with this, if you happen to be on real expensive medications, brand name medications, heart medications, maybe insulin and different things like that, then you want to think long and hard about this one. And I'm going to tell you why. Because normally group plans have better pricing on medications. And Medicare is certainly going to cover prescription drugs, but remember, we have that thing called the donut hole. And that donut hole means typically you're going to pay more money for your medications if you get to the donut hole. When you have a group plan, you don't have the donut hole. So again, you want to make sure that it's not going to hurt you if you do drop your group plan because of your cost of medications. All right, so that's what you're going to do. And I know there's a lot to this question, but all of our Medicare guides are able to walk you through this whole process. So let us know if we can provide further assistance. Thanks for watching. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.